It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from our client Robert. And the question last week was part 8 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our clients and readers. And this week's question is, my dad had a severe head injury 47 days ago and he's still not waking up. He's still in intensive care. What are the next steps? So the following question is an excerpt from an email counseling and consulting session with me and one of my clients, and her name was Antonia. So, Antonia writes, Hi Patrick, on the 21st of September, my dad was hit by a car while cycling. He has not been conscious since after the hit. Around 1 hour and a half after the accident, he has been operated and a huge hematoma on the front right has been evacuated from his brain and the place of explosion was clipped. There were 3 or 4 other trauma places from the head injury. The skull was not broken and no other body traumas were detected. Since the operation, my dad has been in a coma even though he has now been off all sedatives and opiates. And opiates are the painkillers, and he has been off all of that for many weeks. They also did a craniectomy, which is a partial removal of the skull, to ease the brain pressures when he went for brain surgery. However, with the time, currently he breathes alone through the tracheostomy and he's fed via a nasogastric tube through his nose. His organs were not damaged and currently function sufficiently in the given circumstances. He's moving his jaw, seems to have swallowing functions, thus mimics when he's provoked by pain. In recent weeks, he does more arm and leg movements and there are attempts to open his eyes. In several of these attempts, he opens the eyes fully for a few seconds but without conscious response. There are some movements in the arms and hands, more expressed with the left arm and hand, primarily when exposed to some pain stimuli, and recently with the left arm voluntarily movements as well. This is an observation from the series of physiotherapy during which movements of all the joints to full capacity is done. Physiotherapy is being done 2 to 3 times per day currently. So up to date, he had 6 CT scans in total and CT scans of his brain. So on the 21st of September, he had a full body and head CT. On the 26th, on the 28th of September, and on the 5th of October, he had a brain CT. And he had other brain CTs on the 13th, 27th, and 31st of October. An MRI of his brain has not been done yet, but mentioned to be in the plans for the next few weeks, perhaps. His current medication and medical treatment per dosage and hour of intake are Amikin 1 gram, Alcoprol 2 times 40 grams, Nutropil, vitamin C, Depakine, Fraxiparin, calcium gluconate, and Dilcerin. And I've also attached his blood results. Most of it, I believe, looks okay. As of the 13th of October, the CT scan of the brain, it was reported to us that it's visible that there is an improvement and further improvement in the one from the 27th of October. It was reported to us that the CT scan on the 27th of October also shows the risks for developing hydrocephalus. The subsequent scan of the brain from the 31st of October monitored this risk and showed that for the time being it is not a hydrocephalus. However, I did a consultation with an external doctor and he advised a TAP test, which now I'm trying to convince the unit to be done in order to exclude the hydrocephalus as well. 3 weeks ago, the brain activity was measured via the BIS, brain monitoring system, which shows results in a scale from 25 to 100, 100 being the brain of an active conscious person, and Dad's brain activity was measured to be 96. The overall opinion of the doctors is that these measures and CT scan results should correspond to a conscious brain. Unfortunately, clinically, this is not what we see. My dad is 72 years old in a very good health condition generally before the accident. Very fit and active, very intelligent person. He's doing mountain hiking, skiing, he was daily cycling, dynamic and intellectually challenging work, etc. He had never had medical interventions apart from a light hernia repair 2 years ago and regularly monitored and successfully controlled hypertension. The neurosurgeon wants to plant back the bone flap, which according to external doctors is not necessary right now and exposes this person to unnecessary risk of sedation while we are trying to wake him up. I'm quite new to these extraordinary life circumstances and I feel guidance is crucial, which is what I'm missing. I'm not receiving such guidance from the doctors and the ICU either. It seems to me that a coordinated program for recovery is necessary among the intensive care unit, neurologists, neurosurgeons and physio. On the contrary, the unit is only taking care of the bare minimum. I am the one organizing the physiotherapy. Otherwise, nothing is done. I'm fighting with skin wounds. The neurosurgeon seems to be interested only in closing the bone flap. Everybody is negative or acts with apathy. My dad will not have the chance to recover like that. And my efforts from day one are huge, but in vain, as I'm not given as frequent access to him as I would like to. It's a vicious cycle. I am native Bulgarian, but I live in Brussels, Belgium. My dad lives in Bulgaria and the accident happened there. The operation and the current hospital is are in Sofia. The overall problem in the local health system is the post-operation recovery. And we, the family, are very committed to do everything possible to bring our beloved father and husband to a place where he will receive one of the best chances for his recovery. I am exploring options to move him to Germany or Belgium to a dedicated rehab clinic. I don't know if I'm doing it right, and I'm not aware how the transportation could be organized, but the neurosurgeon here in Bulgaria says Dad could be transferred since he's breathing by himself. If you have any advice for the current situation, please let me know. I apologize for the long email, but I'm very confused and not aware what info may be of use. Thus, I give you all the information that I think is important. I soon have to be back to work in Belgium and I dread the moment what I need to organize for my dad's recovery from a distance. I thank you very much in advance for all your time and advice in any direction. It is much appreciated. Best wishes and thank you from Antonia. So, here is my response. Hi Antonia, thank you for being a client and thank you for using my email counseling and consulting service. I really appreciate it. Thank you for explaining and detailing your dad's situation. I'm very sorry to hear about the predicament you and your family are currently experiencing. Let's quickly look at the positives first, though. The only injury your dad has is the brain injury. That's a very significant injury, there is no question around that. He's also safe in respect to him breathing with a tracheostomy spontaneously without the help of a ventilator. That means he has a safe airway and he's able to breathe by himself. This also confirms that most of his other organs are stable, including the lungs. What's also positive, even though you have mentioned that the ICU team is negative, your dad is still alive after 47 days in a coma. Many intensive care teams would have already tried or suggest to withdraw or stop treatment after a few days of not waking up. So those are the positives. A lot of my clients are facing somewhat similar but also different situations in the sense that intensive care teams are negative from day one, and they're trying to coerce families to agree to withdraw treatment after only a few days without giving people the time to recover. The challenges are that you need to look at getting your dad out of this negative environment as soon as possible, because as you have correctly pointed out, he needs to make progress and they are not doing it for him. It's also good that he's getting physiotherapy 2 to 3 times a day. Again, there are many intensive care units where he wouldn't get physiotherapy 2 to 3 times per day. But I also understand and know from experience that the intensive care team will act with more and more apathy the longer your dad will not wake up. That's why it's so important for you and your family to stay positive and also give the situation some meaning. You should also check out some articles and videos around that. The first article and video that I would recommend is how to stay positive if your loved one is critically ill in intensive care. And the other article and video is how to make meaning when your loved one is critically ill in intensive care. I recommend you check out those articles and videos. I understand that your time is limited, especially since you need to go back to Belgium. I can only imagine how frustrated you must be to be in that difficult situation. I also think getting your dad to another country, potentially Germany, for neuro rehab would be a positive step if you can logistically manage it to get it organized. Many rehab centers in Germany are specialized to do neuro rehab. Furthermore, whilst I know that it's frustrating to watch your dad like this, the tests are positive and it looks like the brain has some sort of functionality according to the BIS brain monitoring system. You see, Antonia, what's really important to understand is that anybody after a severe head or brain injury will need time to recover. How much time do people need to recover after a significant head and brain injury? Lots of time, often weeks and months. From my experience, you can't rush these things, and even though the intensive care team is negative, they haven't suggested to stop treating him. That's a positive. I have worked in many intensive care units around the world where a withdrawal of treatment or limitations of treatment have been pushed way too early without giving patients the chance for a meaningful recovery. Therefore, give it more time. Especially with the BIS brain monitoring system showing a positive result, your dad will need time, and your main job at present is to give him that time. Given that I have also worked with many patients in the community who are either on life support with ventilation and/or tracheostomy, you shouldn't give up, because your dad might be able to go home with the right care and right support structure. The pathology results or the blood results look fine. I can't see anything of big concern there. I agree with you that overall guidance is crucial in all of this, and I can see why you feel it's missing. Here are your next steps to stay in control of the situation. First, your dad needs to continue doing physiotherapy 2 to 3 times per day to keep his muscle tones up and to keep getting stimulated. Next, do not buy into any negativity. You need to know that a recovery is possible and that it may take time. Do not engage into any quality of life discussions. You and your family are the only ones who know and understand what your dad accepts for quality of life and hopefully he will come to the point where he can decide himself. Next, do try and find options for neuro-rehab. Also, give the situation some meaning. Only you and your family know what meaning you can give this. Giving a difficult and challenging situation like this meaning will help you to put up with all the difficulties and challenges. Also, given that your dad has been very active physically previously, should also be encouraging to you that he can recover from this. Do not let the intensive care team get away with only taking care of the bare minimum. Demand the best and the best only, and keep asking for it. At the end of the day, you will only get what you ask for. Also, in terms of medications, he's not on a lot of medications, and it also suggests that his main problem is the brain. It's also a good sign that you haven't mentioned any seizure activity. Many patients with significant head and brain traumata often have seizures even though he's on anti-seizure medicine, the Depakine or the sodium valproate. I agree to not do surgery for now and to not put the flap back on. It's not priority for now. With the physiotherapy, you have not shared that they are mobilizing your dad and get him out of bed, but I would highly encourage to get your dad out of bed into a recliner chair again so that he gets stimulated. I'm wishing you and your family all the best, Antonia, and I'll talk to you soon. So, how can you become the best advocate for your critically ill loved one? Make informed decisions. Get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions. Get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing strategies. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.